Top 7 warning signs of poor circulation in the legs. Don't ignore these. Do your legs ever feel cold, numb, or strangely heavy, even when you're not doing anything? You might brush it off as just getting older, or maybe blame it on a poor night's sleep. But what if your body is actually warning you about a deeper issue? Poor circulation in the legs is more common than most people think, especially as we age. And if the signs go unnoticed, it can quietly lead to serious problems, like nerve damage, blood clots, or mobility loss. The good news is that your body usually gives you clues long before things get worse. You just need to know what to look for. In this video, we're breaking down 7 of the most important early warning signs of poor leg circulation that many people overlook. And today, we'll focus on the first 4. These are symptoms that seniors in particular should take seriously because they often show up gradually and can be confused with normal aging. We'll explain why each one happens, how it affects your body, and what you can do to naturally support better circulation. No medications required. Have you ever noticed any of these symptoms yourself? Maybe cold feet at night or a dull ache after a short walk? Drop a comment below and let us know where you're watching from. Chances are, others here have had the same experience. And don't forget to hit the subscribe button so you never miss a tip designed for your health and mobility. 1. Cold feet or toes that stay cold indoors. If you're in a warm room, but your feet still feel icy, that could be more than just discomfort. It might be a sign that blood isn't reaching your extremities the way it should. Your blood carries heat throughout your body. When blood flow is restricted, your toes and feet may not receive enough warm, oxygen-rich blood, leaving them cold and sometimes even pale or blue-tinged. This is especially common in people with peripheral artery disease, or PAD, a condition where arteries become narrowed due to plaque buildup. PAD reduces the amount of blood that can flow to the legs, and cold feet are often one of the first signs. Coldness in the feet isn't always constant. It may come and go, or affect one foot more than the other. But over time, if circulation doesn't improve, you may notice the skin on your feet becoming dry, cracked, or more sensitive to temperature changes. To support better blood flow, try light daily movement. Flex and stretch your ankles and toes even while sitting. Keep your legs uncrossed when seated to avoid putting pressure on blood vessels. Warm foot baths can encourage circulation, and wearing socks made from natural fibers can help trap heat without cutting off circulation. Nutritionally, make sure you're getting enough iron, B12, and folate. These nutrients help your body produce healthy red blood cells, which carry oxygen through your bloodstream. Seniors are more prone to deficiencies, especially if they've had digestive issues or follow restrictive diets. Foods like eggs, lentils, leafy greens, and fortified cereals can help boost levels naturally. 2. Numbness or tingling in the feet and legs. That pins and needles sensation in your legs might not be so harmless after all. If you're experiencing tingling, numbness, or a crawling feeling in your legs or feet, especially at night or after sitting for a long time, it could signal nerve problems caused by poor circulation. Your nerves need a steady supply of oxygen and nutrients to function properly. When circulation is limited, those nerves may begin to misfire, sending strange signals to the brain, or none at all. That's why numbness often goes hand in hand with tingling. In severe cases, poor circulation can lead to peripheral neuropathy, where nerve damage becomes permanent. This is especially important for seniors, as aging naturally reduces the elasticity of blood vessels. Conditions like diabetes, high blood pressure, and high cholesterol further increase the risk of circulation problems that affect nerve function. To ease tingling, avoid sitting in one position for too long. Stand up and move around every 30 to 60 minutes, even if it's just for a minute or two. Gentle leg stretches and foot circles can also help stimulate circulation to the nerves in your lower body. From a dietary perspective, focus on foods rich in magnesium and B vitamins, especially B6 and B12. These help protect nerve linings and support healthy electrical signals between the brain and muscles. Bananas, almonds, spinach, salmon, and whole grains are all great choices. If you're diabetic or borderline, managing blood sugar levels is essential. High blood sugar damages the blood vessels that supply the nerves, leading to even worse circulation and long-term nerve dysfunction. Staying hydrated and limiting processed sugars can help stabilize glucose levels naturally. Third, pain or cramping in the legs while walking. If you often feel a tight, cramping sensation in your calves, thighs, or hips after walking, even just for a short distance, but feel better once you stop and rest, this could be intermittent claudication. It's a common sign of reduced blood flow to the muscles during activity. When you walk, your leg muscles need more oxygen to keep going. But if your arteries are narrowed, your muscles can't get the oxygen they need. As a result, you feel cramping, burning, or even a deep ache. The pain usually disappears after a few minutes of rest because your oxygen demand drops, and whatever blood flow is available can catch up. This isn't just about comfort. It's a sign that your circulatory system is struggling. Left unaddressed, the blockages can worsen over time, leading to more severe symptoms and increasing your risk of serious vascular conditions. Many people confuse this kind of pain with arthritis or muscle fatigue, but the pattern is what makes it different. Pain during activity, relief during rest. To combat this, gentle walking is actually one of the best remedies. It might feel counterintuitive, but regular low-impact movement encourages your body to build new pathways for blood to flow, a process called collateral circulation. Swimming or stationary cycling can also help if walking is painful. Add foods to your diet that support vascular health, like fatty fish, flax seeds, avocados, and olive oil. These contain omega-3 fatty acids, which help reduce inflammation and keep blood vessels flexible. And always make sure your shoes provide proper support to reduce muscle strain and improve comfort during activity. 4. Skin discoloration or changes in texture. Take a look at the skin on your lower legs. Does it appear darker than the skin on the rest of your body? Maybe there's a reddish or purplish tone, or the skin seems shinier, tighter, or thinner than usual. These subtle changes are often signs that blood is pooling in your veins instead of flowing efficiently back to your heart. This condition is often related to chronic venous insufficiency, where the valves in your leg veins don't close properly, allowing blood to leak backward and collect in the lower legs. Over time, this causes pressure and swelling that leads to visible skin changes. In seniors, this can result in flaky or itchy skin, a leathery texture, or even the development of small rashes. If left untreated, it can progress into open sores that are slow to heal. You might also notice spider veins or bulging varicose veins developing in the same area. To improve symptoms, try elevating your legs for 15 to 20 minutes, 2 to 3 times a day. This helps move blood back toward the heart and reduces pooling. Avoid sitting or standing in one position for too long, and consider wearing compression stockings if swelling is present. Topically, keep the skin moisturized with gentle creams to prevent cracking. Internally, vitamin C and rutin, found in citrus fruits and buckwheat, help strengthen blood vessel walls. Drinking plenty of water and reducing sodium intake can also prevent fluid retention, which makes the problem worse. Wearing loose, comfortable clothing and avoiding tight bands around the ankles or calves can also help keep circulation flowing smoothly. 5. Swelling in the feet, ankles, or lower legs. If your socks leave deep marks at the end of the day, or your shoes feel tighter than they did in the morning, it could be more than just a long day on your feet. Swelling, especially in the feet, ankles, or lower legs, is a common yet often overlooked sign of poor circulation. While occasional puffiness might come from standing or sitting for long periods, chronic swelling usually points to fluid buildup caused by inefficient blood flow. When blood doesn't return to the heart efficiently, it can pool in the lower extremities. This creates pressure in the veins, forcing fluid out into the surrounding tissues. That's what causes that puffy, tight feeling. This is particularly common in seniors, as the valves in leg veins can weaken with age, reducing their ability to push blood upward. Swelling from poor circulation typically worsens throughout the day and improves overnight when the legs are elevated. You may also notice a heavy or achy feeling in the legs, and in more advanced cases, the skin may become stretched, shiny, or discolored. To relieve swelling, elevate your legs above heart level for 15 to 20 minutes a few times per day. This helps fluid return toward the heart, reducing pressure in the veins. Wearing compression socks can also provide gentle pressure that improves blood flow and prevents fluid buildup. Just be sure they're fitted properly. Too tight, and they may cut off circulation entirely. Lifestyle changes can make a big difference. Reducing your salt intake helps limit water retention. Drinking enough water may sound counterintuitive, but staying hydrated actually helps flush excess sodium out of the body. Gentle movement like walking or foot exercises can activate your calf pump, a natural way your body pushes blood back toward the heart. Certain medications like diuretics or calcium channel blockers may contribute to leg swelling. So if you're experiencing this regularly, it's important to speak with a healthcare provider to rule out other causes and review current prescriptions. Nutritionally, foods like cucumbers, celery, watermelon, and berries have natural diuretic properties that can help the body shed excess fluid. Potassium-rich foods like bananas and sweet potatoes also balance sodium levels and support fluid balance in the tissues. 6. Wounds or sores that heal slowly. Have you ever gotten a small scrape or blister on your leg or foot that just didn't seem to go away? Maybe it lingered for weeks or even months. If wounds are taking longer than usual to heal, it's a strong warning sign that your circulation may be compromised. Blood flow is essential for healing. Oxygen, nutrients, and immune cells all travel through your bloodstream to reach the site of a wound. When circulation is poor, these critical elements don't arrive efficiently, slowing down the body's natural repair process. As a result, even small injuries can develop into more serious problems, such as ulcers or infections. This is particularly dangerous for seniors, especially those with diabetes. High blood sugar damages blood vessels and nerves, which further reduces the ability to feel pain and recognize injuries in the first place. Many diabetic seniors develop foot ulcers that begin as small, unnoticed wounds, especially when combined with poor circulation. Signs of poor healing include wounds that scab over but reopen, ulcers that ooze or become painful, or areas of skin that appear raw and don't regenerate properly. You might also see darkened skin around the area, a bad smell, or increased redness, all signs of infection. To support healing, check your legs and feet regularly for cuts, blisters, or pressure spots, especially if you have reduced sensation. Keep the skin clean and moisturized. Wear shoes that fit properly to avoid rubbing and pressure, and avoid walking barefoot, even at home. Foods that support healing include protein-rich sources like eggs, beans, poultry, and fish. Protein helps rebuild damaged tissues. Vitamin C supports collagen production, a key component in skin repair. Zinc also plays a major role in the immune response and wound closure. Pumpkin seeds, cashews, and legumes are all excellent sources of zinc. Poor circulation-related wounds are also more likely to become infected, so it's important to be proactive. If a wound isn't improving within a week or two, or seems to be getting worse, seek medical attention. Early intervention is critical. 7. Restless legs or uncomfortable leg sensations at night. Do your legs ever feel jumpy, twitchy, or full of strange sensations once you lie down to sleep? Maybe it feels like something is crawling under your skin, or you just can't get comfortable unless you keep moving. These nighttime symptoms are often associated with restless leg syndrome, or RLS, but poor circulation could be contributing more than you think. When blood flow is reduced, your muscles and nerves don't receive enough oxygen or nutrients, especially during rest. At night, circulation naturally slows, and if your body is already struggling to deliver blood to the legs, you may notice an increase in uncomfortable sensations as your muscles and nerves try to respond to the shortage. While RLS has multiple causes, many cases are linked to low levels of iron or magnesium, two nutrients also essential for circulation and nerve function. Seniors are particularly vulnerable to deficiencies due to changes in diet, medication interactions, or poor nutrient absorption. Restless legs can be mild or severe. Some people feel a constant need to shift positions, stretch, or walk around to ease the discomfort. Others describe it as tingling, buzzing, or a deep internal itch that can't be scratched. This constant disruption often leads to poor sleep quality, which over time can affect memory, mood, and overall health. Fortunately, many people find relief with simple lifestyle changes. Try avoiding caffeine and heavy meals late in the evening. Build a calming bedtime routine with leg stretches, warm baths, or gentle massage to improve blood flow before bed. Elevating your legs for 10 to 15 minutes before lying down can also help. From a nutrition perspective, focus on iron-rich foods like lean red meat, lentils, spinach, and fortified cereals. Pair iron with vitamin C-rich foods like oranges or bell peppers to improve absorption. Magnesium can be found in almonds, black beans, and leafy greens. Some people also benefit from magnesium supplements, but always speak with your doctor first. Movement throughout the day is equally important. Staying active helps maintain blood vessel function and reduces pooling in the legs that can make symptoms worse at night. Even light walking or stretching during commercial breaks or phone calls adds up. Before we wrap up, here's something extra we wanted to include, because it's too important to leave out. Bonus sign: leg hair loss or slower hair growth on the legs. Yes, it may sound surprising, but changes in leg hair, specifically thinning or complete hair loss on your shins or calves, can actually be a sign of poor circulation. Hair needs a steady supply of oxygen and nutrients from the bloodstream to grow and stay healthy. When blood flow to the legs drops off, those hair follicles don't get the support they need, and growth slows down or stops altogether. This isn't just a cosmetic issue. Hair loss on the legs can indicate that arteries are narrowing or hardening, which means less oxygen-rich blood is reaching the skin and surrounding tissue. Over time, this can lead to dry, flaky skin, poor healing, and increased sensitivity in the area. If you've noticed that you're shaving less often, not because the hair is finer, but because it's simply not growing, it's worth paying attention, especially when combined with other signs we've covered today. To support healthy circulation and skin function, continue focusing on nutrient-rich foods, daily movement, hydration, and checking your legs regularly for changes. Even small observations like this can give you a head start in protecting your long-term health. It's one more reason to stay informed, stay observant, and take action early. Because when it comes to circulation, the little things add up in a big way. Bringing it all together, you've now learned all 7 of the major warning signs of poor circulation in the legs: cold feet, numbness or tingling, pain during walking, skin changes, swelling, slow healing wounds, and nighttime discomfort. Now, here's the good news. You don't have to address each sign separately. These symptoms are all connected, and so are the solutions. That's what makes this powerful. It's not 7 separate problems. It's one system asking for support. That means you can build one smart, simple plan that helps your circulation, your nerves, your muscles, and your energy, all at the same time. Think of your body like a team. Your blood vessels are the delivery trucks. Your nerves are the communication lines. Your muscles are the workers. Your skin is the front line. If circulation slows down, the whole team suffers. But when you support blood flow, the entire system works better together. If you've noticed one or more of these signs in yourself or someone you care about, don't ignore them. Start by making 1 or 2 changes this week. Add a 15-minute walk after lunch. Drink an extra glass of water. Or include more leafy greens in your meals. These small shifts can make a big difference. Then support your body with the right nutrients. B vitamins for nerve health, iron and vitamin C for strong blood, magnesium and potassium for muscle function, omega-3s and antioxidants for flexible, resilient vessels. These don't need to come from pills. Many are in everyday foods: leafy greens, berries, eggs, nuts, beans, citrus fruits, and fatty fish. Also, keep an eye on foot care. Moisturize daily. Check for cuts or pressure spots. Choose socks and shoes that don't restrict blood flow. And most importantly, don't ignore these signs. Your body speaks. It's up to you to listen and respond. Remember, it's not about chasing perfection. It's about noticing the signals your body is sending and responding with care, consistency, and patience. That's how you keep your legs and your whole body strong and steady for the road ahead. If this video helped you recognize something in your own life, drop a comment below and share your experience. What symptoms have you seen? What changes have helped you feel better? And what topics would you like us to cover next? Tap that like button if you found value today, and subscribe to stay connected with this growing community of people who are taking control of their health, naturally, simply, and together. We've got more practical, senior-friendly health tips on the way. Until then, stay well, stay aware, and keep moving forward, one step at a time.